Hey guys, welcome to Respiratory 2140. This video is arterial punctures or arterial blood draws or ABG draw. First, we're going to go over the equipment and then we'll go over the procedure. So just as with any lab procedure, you need to verify your orders, identify your patient, and wash your hands and use universal precautions to prevent infection, the spread of infection. So speaking of the spread of infection, since we are going to be dealing with body fluids and samples, we need a biohazard bag to transport our sample. That's a universal regulation. You can put your patient identifiers here. A lot of facilities have patient identifier stickers you can print to stick to your sample. We have both iodine and alcohol to clean the area before we puncture. A Band-Aid for after we withdraw the needle. The actual ABG syringe that is heparinized. The heparin helps keep the sample from clotting so that when we run the sample, we don't have any issues with having a clog up the machine and we get appropriate sample readings. This is an additional cap that we use if we need to take our needle off, and we can use the cap to block our needle. This is a bigger needle for if we need to do brachial or femoral punctures, gauze for cleaning up any blood, and then an additional piece of rubber that we can stick our needle in to keep it safe, because we want to be very careful when we have an open needle. So that is our equipment. Let me make some introductions. This is Erin. She is a respiratory therapist, and this is Liz. She's also a respiratory therapist. These both are amazing women.
And work wife.
And yeah, this one's my work wife. So they are going to be doing the arterial puncture so that we can get a good angle.
Okay.
So first off, Liz is going to do what is called a modified Allen's test, which what happens with a modified Allen's test is you will block both the radial and ulnar artery.
Sorry.
Have your patient make a fist, open up.
Do it again.
We can see that the skin is white due to blood loss.
There you go.
And then as it becomes pink, it's because we are looking for collateral blood flow. And that is what it is if we get any damage to our radial artery here on the side of the thumb, we will have arterial blood flow through the ulnar artery. And it's just a safety procedure for in case there's any risk to damage to the radial artery.
This is iodine.
So she's going to open up the iodine and clean the area. A few risk factors for drawing an arterial blood gas will be hematoma in the site, possible infection because we are breaking the skin. It's also contraindicated if there is a dialysis fistula, because that is where where venous and arterial blood mix, so that we won't get a proper sample and it affects blood flow in the arm. Major burns or damage can make it so it's difficult to get a blood gas, and also if the arm is missing, you can't get the blood gas. So she is prepping her Band-Aid for after her stick, sticking it on her glove. It's best to take the time. A few tricks with getting an arterial sample is take the time to make sure your equipment is prepped how you want it. So get the bevel up where you want it, tighten all of your attachments so that blood doesn't come out, and then be very careful when...
Yeah, see the bevel?
Yep.
Make sure
The bevel's up. So that we can be very cautious when we take the cap off.
How much do we need on this?
I put down to 8, but technically only need 3.
Yeah, so she was asking how much. So technically to run one sample, you need about 3. But if you need multiple samples, you can run from the same sample. And we're ready when you are, Liz.
Okay.
Okay, so it's best to line up, get yourself comfortable, have gravity work with you, because with blood flow, if the arm is up and the fingers are up, it'll be harder to feel than if it's down and the wrist is in a good neutral position. So she is feeling. So a couple different tricks. You can place a mark with your fingernails once you feel it. You can go up higher where you can feel it near the wrist. Or you can go down to kind of where it's a little more meaty on the arm. You do have to worry about bone and nerves, but it's best to just be careful.
Okay.
Okay, when you're ready, I'm ready.
Okay.
So she's going to uncap her needle.
Needle out.
She has a needle out. She's going to feel again. Once she feels and is ready,
1, 2, 3, poke.
she's going to poke where she feels.
I missed. I'm going to come back out to the bevel.
Okay, perfect. So since she missed, she's going to come out to the edge of the bevel but not remove the needle entirely.
Okay.
And she's going to readjust. We don't want to do what's called fanning the needle, which is with the needle in, we move and adjust because that's just going to cause damage. So that's why we come out, we feel again, and we restick.
How many times can I do that?
Well, it doesn't hurt, so I'm okay.
Okay.
But you can readjust however many times you need to.
Yeah, as long as the needle doesn't come out, you can
There
readjust.
we go. Got it.
Okay, as you can see, that is bright red blood
Yeah, mama.
filling up the syringe. So an ABG needle, what makes it different
Got it.
is we don't have a negative pressure vacuum because we use the pressure from the heart because it's an artery to help fill up the syringe, where with a venous straw, we need a vacuum to help with that negative pressure to help fill up and get the samples we need. Notice how Liz is moving her syringe gently back and forth.
Oh.
That's to help get or rolling it, whatever technique. Mostly you just don't want to be aggressive with shaking your sample so that we don't hemolyze or cause clots. So she was just rolling it to get that heparin there so that our blood sample doesn't
I
clot.
want to look too.
Yep, she checks her site, makes sure that there's not excessive bleeding, no damage, and then applies a Band-Aid or a piece of Coban.
Yeah.
There we go. Then you make sure your patient is in a clean, safe environment and place your sample in a biohazard bag to go down and run the sample. And our patient and our RT, our 2 RTs, are fabulous in helping. Thank you so much, guys. You can also attach the cap there, and you want to make sure there are no bubbles in your sample because that can affect your PaO2 levels.
Mm-hmm.
All right, and that is arterial blood gas sampling. If you come with questions, we have mannequin arms to practice on, and it'll be great.
Dispose of your sharps, people.
Yep, make sure you throw your sharps in the sharps container.
Okay.
Okay.